to introduce you to Dr. Julia Tainijoki. Welcome, Julia.
Thank you very much for the invitation.
Let me introduce you first to Julia. She is the Senior Medical Advisor of the World Medical Association, representing the millions of physicians worldwide. I haven't found the right position yet for myself, but I think down here is a bit better. Yeah. Okay, Julia, are you ready?
Yes, I am. And welcome and good morning, everyone.
So the World Medical Association represents physicians. Just to give you a little bit of a background, because I'm not sure whether you know World Medical Associations well, because it promotes the highest possible standards of medical ethics and provides ethical guidance to physicians through declarations, resolutions, and statements. And I would like to go even a little bit deeper. The declarations, resolutions, and statements cover a wide range of subjects, including an international code of medical ethics, the rights of patients, research on human subjects, care of the sick and wounded in times of armed conflict, torture of prisoners, the use and abuse of drugs, family planning, and pollution. So, Julia, in Georgia's speech, we heard several examples of why we experience this health workforce crisis today. In your own words, what did you perceive, or how does this crisis affect your work as the advisor for the World Medical Association?
Thank you. I'm just coming back from our General Assembly of WMA, which we held last week, and I would like to report back there. We had a session on human resource for health, on migration, and I think I have some interesting insights. There are general problems to this, which refer to all countries, and there are some specific aspects. The general ones are, I have to phrase it right away, we have a high burnout rate, and that especially increased after COVID. One reasons are the poor working conditions. Is it because, as we have heard, we have a shortage of staff, which leads to high workload, lots of pressure. Health professionals don't have time to do this work, this caring, healing, health treatment with the patient. This affects as well the work-life balance. And on the other hand, we have missing supervision, mentoring. Just imagine, Georgia spoke as well about the young physicians, for example, which are often sent right after university to rural places. And if you are then there, the only physician without anyone to ask with experience, what do I do in this case? You feel overwhelmed, you feel lost. It's as well the career prospect in many areas, the continuous professional development and education. But it's as well the fair and timely and equal remuneration, clear working contracts and clear scope of practice, and maybe not only 1-year contracts, having something longer. Another big topic is the occupational safety, harassment, violence. Harassment and violence is really what I have heard from our session, a huge problem. And unfortunately, it's not only in healthcare settings, police, firemen, teachers, they all complain about. But it's very weird when you are in accident and emergency. And I had this time as well, and there was always a policeman next to me, because otherwise I'm not safe. But if I need to have this personal connection with my patient and a policeman is standing there in front of the door, you can't get this relationship, what I would need to really treat and listen to the patient. So all these reasons leads to a high attrition rate, and it's far more difficult to attract young health professionals for this profession. And on the other hand, we have this aging population, aging health workforce. So there are a lot of pressures and burden on the health workforce, on the health system. And then I would like, it was very important for our African members that I mentioned this one. Here in Africa, we have an increasing unemployment rate for young physicians. And it's a very strange situation. On one hand, we are missing physicians. We have very low rates of physicians per capita. But on the other hand, these young physicians can't find jobs. So there is an imbalance and a lack of cooperation and budgeting between the Minister of Health, who would need to create more jobs, the Minister of Education, who has increased the education of physicians and produced more physicians, and the Minister of Finance, who would need to free the budget. And the frustration rate is here quite high. And if you're a physician or a nurse or whatever health professionals, and you're just out of practice, out of school or university, you need to practice. Otherwise, you're losing your skills, or you're not gaining your skills. And we saw in recent times strikes of young physicians in India, Korea, Kenya. Is it either for working conditions, or is it about protection against violence and harassment? Before it was strikes in UK. So the situation is quite tense. And that is what we see as World Medical Association when we talk with our members.
Thank you so much for these insights. During the COVID pandemic, because this landscape has changed a lot during the COVID pandemic. And what were your observations from then on?
COVID-19 has exacerbated the situation. It has exposed the fallout from decades of underinvestments in health. And we mainly saw it in two ways. On one hand, as a consequence, the attrition rate of health professionals has increased. And on the other hand, we have the disruption of services of care, health care. So just as an example, right after COVID, we saw cancer patients with far higher stages of cancer than before. All these preventive measures we had before, the screening, was not available. The vaccination for young kids dropped in many countries, either completely or really a lot. We have now outbreaks of polio, measles again, which we hadn't had before. So that is the situation. I would like to talk now here a bit about a report which WHO and the 5 health professions, the World Health Professions Alliance, which is physicians, nurses, pharmacists, dentists, and physical therapists, have released. The title is What COVID-19 Pandemic Has Exposed, Finding of the 5 Global Health Workforce Professions. And it's very much related to what I have said before. The lesson learned from COVID-19 is, as a main subject, we need to strengthen health system and support the health workforce better. Because we saw in countries who has a strong health system, they had still capacities to deal with COVID and keep up the regular health system and do all these screenings, these preventions, these non-treatments. In fragile states, they had no capacity. Everything was just pulled around Corona and taking care there. And on the other hand, they didn't have the strength and the capacity to support and protect the health professionals. So that's why in the report, we ask for excellent and safe working conditions. We ask for protection of health workers, and they're including mental and psychological support. And that goes far beyond COVID. Obviously, COVID was a special situation where special mental and psychological support was needed. But when we see the burnout rates, the mental state of health professionals, it's a constant process which we need. And what is really, really important is this work-related violence and harassment, and especially there with women and youth. I heard a noise.
Oh, good.
And where we said health professions would need to be involved in the planning and the health workforce planning on a national stage, because we have the insight. We can give them our experience. It's something very different if the someone in the Ministry of Health is sitting at the desk, or if you can talk with experience, what's really the problem in the healthcare system.
Thank you, Julia. Now we move on to the last question. In your perspective, what needs to be done from the World Medical Association to enhance health systems to fully utilize the capabilities of health professionals and thereby improving the quality of healthcare?
Well, at the moment we are facing many challenges. Is it the implementation of universal health coverage? Or is it antimicrobial resistance, non-communicable diseases, pandemic preparedness, climate change, you can name it. The only way to solve it can be to strengthen health system in general, so that they are prepared to address all these challenges in a holistic way. And we don't end up like in the past where each topic is competing about resources with the other one. And the way forward, how WMA sees this, is to implement universal health coverage is through a strong primary healthcare system, but which is then closely linked to hospital care, to prevention, health promotion, rehabilitation, and even including the social determinants of health and addressing them. And all this should be done in a multidisciplinary team. So just for example, on a primary healthcare level, depends then on the situation, on the region, on the patient, which health professionals would be included. Is it community health workers, nurses, physical therapists, dietitian, social worker, physician? But important is, if we have such a team, they need to have a lead. So that someone needs to have the overview of what's happening, pull the strengths together, and communicate with the patient so that the patient is not lost. So the continuity of care is important. Patients should be in the center, should know what's happening, but in this hub approach. And depending on the situation and the patient, we think the physician would be then the lead, because with the highest education has the overview. But as I said, that depends on the individual situation. And then it's important as well to use more digital health technologies, but not in this sense that we would replace health professionals. It's rather to support them, to give a different way of working with the patient together. And another topic, important one, is the health workforce planning, which should be not only done on population health needs, should be based on population health needs and not only on what is the ratio between physician per capita or how many services are used. And for example, in high and middle income country, we have aging population. So a different care and healthcare system is needed and more care is needed. This needs to be taken into account. And important is there as well to plan the health service model and the workforce together to link it. Again, this rather holistic approach and not separate. And to work there in partnership so that, for example, the Minister of Health, the Human Resource for Health Unit, together with health professionals, research institutions, professional and association, NGOs, other organizations. It very depends on the topic because healthcare is a cultural thing. You can't take one health system and put it to the other one. It's developed over years, and so depending on the national situation, involve the relevant stakeholders and plan it together.
Thank you so much, Julia, for this interview and for these insights into your work. Thank you so much for being here.